Gout is a type of arthritis that results from the accumulation of uric acid crystals in the joints. It is characterized by sudden and severe attacks of pain, swelling, and redness, typically in the big toe, but it can also affect the knees, ankles, wrists, and fingers. So, what causes gout? There are several known risk factors for developing gout, including 1. Diet. A diet high in purines, which are found in certain foods such as red meat, seafood, and alcohol, especially beer, can increase the risk of gout. There are several dietary changes that can help reduce the risk of gout attacks and improve overall health. Reduce intake of purine-rich foods. Purines are compounds found in certain foods that are broken down into uric acid in the body. Foods that are high in purines include organ meats, such as liver and kidney, anchovies, sardines, and meat-based broths. Limiting intake of these foods can help reduce the risk of gout attacks. Increase intake of low-purine foods. In contrast to purine-rich foods, low-purine foods are not likely to contribute significantly to uric acid levels. These include most fruits and vegetables, grains, and dairy products. Drink plenty of fluids. Staying hydrated can help flush excess uric acid out of the body, which can help prevent gout attacks. Aim to drink at least 8 to 8 ounces of water per day. Limit alcohol intake. Alcohol, particularly beer and hard liquor, can increase the risk of gout attacks. Limiting alcohol intake, particularly during a gout attack, can help reduce the severity and duration of symptoms. Maintain a healthy weight. Being overweight or obese can increase the risk of gout attacks. Losing weight through diet and exercise can help reduce the risk of gout attacks and improve overall health. It's important to note that dietary changes alone may not be enough to effectively manage gout. If you have gout or are at risk of developing it, it's important to speak with a healthcare provider about the best course of treatment. 2. Obesity. Being overweight or obese increases the risk of gout, as excess body fat can lead to higher levels of uric acid in the blood. Gout is just one of the many reasons it is highly important to maintain a healthy body weight. 3. Age. Gout is more common in men over the age of 40 and women over the age of 50. This age group is the highest risk for gout, but it can strike adults of any age if the conditions are right. 4. Family history. If you have a family history of gout, you are more likely to develop it yourself. Just like many health conditions and diseases, gout is more likely to strike those who have a family history of it. 5. Certain medications. Some medications, such as diuretics and aspirin, can increase the risk of gout. If you are prone to gout, be sure to address this with your doctor or pharmacist when being prescribed medication. 6. Dehydration. Not getting enough fluids can increase the risk of gout, as it can lead to a higher concentration of uric acid in the blood. Always be sure to drink the proper amount of water, as failing to do so has numerous health consequences. It's important to note that gout is a treatable condition. If you are suffering from gout, it's important to speak with a healthcare provider to determine the best treatment plan for your individual needs. However, there are a few general strategies that can be effective in managing gout symptoms and reducing the risk of future attacks. One of the most important things you can do to manage gout is to maintain a healthy diet. This means avoiding high-purine foods, such as red meat, organ meat, and certain seafood, as these can contribute to the buildup of uric acid in the body. Instead, focus on eating plenty of fruits, vegetables, and whole grains, as well as low-fat protein sources like beans, tofu, and poultry. It's also important to stay hydrated by drinking plenty of water, as this can help flush excess uric acid out of your body. Additionally, limiting your alcohol intake, especially beer and hard liquor, can be helpful in preventing gout attacks. Medications can also be an effective way to manage gout. Your healthcare provider may prescribe medications to reduce inflammation and pain, as well as medications to help lower the level of uric acid in your body. These can include non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and medications called xanthine oxidase inhibitors or uricosurics. In some cases, your healthcare provider may recommend lifestyle changes to help manage gout. These can include losing weight if you are overweight, as excess weight can contribute to gout attacks, and engaging in regular physical activity, as this can help reduce inflammation and improve overall health. If you are struggling with gout, it's important to work with a healthcare provider to determine the best treatment plan for you. By following these strategies and working with your healthcare team, you can effectively manage your gout symptoms and reduce the risk of future attacks. If you would like to learn how to overcome the painful condition of gout simply from eating foods that are found in a common supermarket, then be sure to click the link below and put an end to the misery.